Effect of simulation skill-based CISC education programs on the adherence to prescribed schedule catheterization. When the patients cannot empty their urinary bladder, either from neurogenic bladder, spinal cord injury, they should have intervention to empty their bladder, unless they will have UTI, urinary tract infection. The best choice of intervention for this problem is CISC, clean intermittent bladder self-catheterization. It makes better quality of life, more than indwelling urinary catheter. Also, less and least, UTI happen with CISC if they can do CISC regularly as prescribed. Problem: many female patients were unable to follow the instructions because of various things, such as poor visualization of their perineum, equipment problem, and inconvenience for daily life that cause increased risks of infection. Objective: to improve the adherence of patients by using simulation skill-based CISC education program. Research intervention: the in-charge nurse who explained the fact of CISC to patient using materials, CISC booklet, 3D animation video, CIC box, and other equipment to simulate the CISC process to the patients. It comprises of 1. Explain the CISC quantity and safety. 2. Develop positive values, intentions, and motivation. 3. Develop skills to carry out the quantity and safety of the CISC. Practical techniques such as hygiene competencies, preparing CISC, and abilities to apply adaptive and positive behavior to deal with everyday life. Materials: 1. CISC booklet and 3D animation video for CISC training. Simulation include hygiene of hands and perineum using single hand technique. Two, CISC simulation is a toilet stall simulation, CIC box, with a mirror to point out structures in the perineum. CIC box. When lift the cover of the CIC box, the toilet stall simulator, it has a mirror to point out structures in the perineum and locate the urethral meters. CIC box is the all-in-one CISC simulator. It helps obese female patients do CISC successfully more than conventional training and can reduce CISC training time from 105 minutes to 25 minutes. Three, CIC bag as portable set for CISC comprises of personal hygiene equipment. The CIC bag can go anywhere you want with hygiene CISC equipment inside, using with single-hand technique. Inside the CIC bag, it has multiple pockets suitable for placing CISC equipment and can fix the catheter. The bag can be hung on the wall, and using single-hand technique, patients can apply with their daily life, support more regular CISC time, and decrease risk of infection. Measurement of improvement. 12 female adult patients were recruited. Outcome measure were the rate of the regularity of CISC according to prescribed schedule record, at before and after program, and rate of urinary tract infection. Data were analyzed using pair t-tests. Effect of changes. Before program implementation, patients unable to do CISC during the day for 50% and at midnight more than a half. 1 month after program implementation, most of them increasingly adhere to the prescribed regularity, and incidence of urinary tract infection was not found. Lesson learned. These mean that the simulation skill-based CISC education program and appropriate equipment support help the adherence to the prescribed schedule regularity of CISC and the decreased incidence of UTIS. Message for others. Increasing the adherence to the prescribed schedule regularity may help reduce the risk of catheter-associated UTIS. Advanced CISC backset is hygienic by design because of the protective contamination. Structures and conditions of the learning environment are as important to address as individual factors. Equipping patients with knowledge, attitudes, and skills through simulation is analogous to providing protection against germ threats, both behavioral and environmental change.